Deep in the hills of Louisville, Kentucky, stands one of the most haunted places in America. Waverly Hills Sanatorium, a place where thousands came seeking healing from tuberculosis, but where over 63,000 patients would meet their end. Built in 1910, this massive 5-story brick building treated tuberculosis patients for decades. When antibiotics finally made sanatoriums obsolete, Waverly Hills closed in 1961, leaving behind dark secrets and restless spirits. Today, we're exploring the terrifying history and paranormal mysteries of this abandoned hospital. But first, if you love real horror stories and urban exploration, hit that like button and subscribe. Waverly Hills Sanatorium opened during one of America's deadliest health crises. Tuberculosis was ravaging the population, and this facility was built to isolate and treat patients with what was called the White Plague. The hospital was designed to hold 400 to 500 patients, but during peak years, it housed thousands. Treatment methods were primitive: fresh air, sunlight, and rest. Patients would lie on open-air porches for hours, even in freezing winter temperatures. But here's where the story gets darker. The death rate at Waverly Hills was catastrophic. Official records show 63,000 deaths, though some researchers believe the actual number is much higher. To prevent panic among patients, staff created the infamous death tunnel, a 500-foot underground chute that carried bodies from the hospital to the bottom of the hill. This way, dying patients wouldn't see the constant stream of corpses being removed, maintaining false hope for recovery. The building closed in 1961 when antibiotics made tuberculosis treatable, but after 20 years of abandonment, it briefly reopened as a geriatric hospital in the 1980s before closing for good in 1996. The death tunnel is perhaps the most chilling feature of Waverly Hills. This 500-foot-long, brick-lined tunnel runs underground from the hospital to the railroad tracks below. Bodies were placed in wooden crates on a trolley system and rolled down the tunnel to waiting trains, which transported them to the morgue. The tunnel was designed to hide the reality of death from patients, but today, it's become ground zero for paranormal activity. Visitors and paranormal investigators report hearing disembodied footsteps, feeling cold spots, and seeing shadow figures in the tunnel. Some claim to hear the sound of the trolley rolling, even though it's been gone for decades. The tunnel represents one of the darkest chapters of Waverly Hills, a physical manifestation of the fear and denial surrounding death. Waverly Hills is considered one of the most haunted locations in America. Paranormal investigators have documented countless strange phenomena over the years. The most infamous location is room 502 on the 5th floor. According to legend, a nurse hanged herself in this room in 1928 after discovering she was pregnant by a doctor, who abandoned her. Another story claims a doctor committed suicide there after treating patients during the tuberculosis epidemic. Visitors to room 500 to report seeing a shadowy female figure in the window, hearing crying and sobbing sounds, feeling an overwhelming sense of sadness, experiencing sudden temperature drops, seeing the door swing open on its own. Other reported hauntings include a child's laughter echoing in empty corridors, a nurse in white walking the halls, patients coughing in abandoned patient rooms, wheelchair tracks appearing on dusty floors, voices caught on EVP recordings calling for help, former security guards who watched the abandoned building in the 1970s and 80s quit after reporting terrifying encounters with apparitions and unexplained sounds. Today, Waverly Hills has been partially renovated and operates as a tourist attraction offering paranormal tours, but much of the building still shows decades of decay and abandonment. Peeling paint covers every surface, broken windows let in wind and rain. Old medical equipment rusts in abandoned rooms. Patient records and personal belongings were left scattered throughout the building. The 5th floor, where the sickest patients were kept, remains particularly eerie. Empty bed frames line the walls of patient rooms. The solarium where patients sought healing sunlight now sits in ruins. Despite renovation efforts, visitors report that the spirits of Waverly Hills haven't left. The energy of suffering, death, and despair seems permanently imprinted on these walls.